Hello, my name's Bronwen and I am a registered nurse, and I've been working with Professor David, who's the head of the Craniofacial unit, for about 15 years.
Did you start?
Well, I started working with Professor David, like scrubbing for him in the operating theatre about 15 years ago, and then he asked me to come and work in his private consulting rooms about 13 years ago, and yeah, so it's been a long association. Yeah, I work 2 days a week in the operating theatre and 2 days a week in his consulting rooms. So I suppose my association with the foundation is as part of the clinical team that the Craniofacial Foundation supports. Yeah. So I've got quite a unique job, really, because I get to meet the patients when they first come in for their consultations. That may be the very first time they're coming in to see Professor David, or it may be a review after a couple of years. And then I see them in the operating theatre. I always make sure I say hello before they actually come in and have their anaesthetic. And then I see them back in the consulting rooms afterwards for their post-op care. And then, you know, down the track when they come in for reviews again. Yeah, a lot of people come in and say, I'm being teased, so I want some surgery to fix something. And Prof's answer to that is, well, you know, don't operate on yourself because you're being teased. It's the people that are doing the teasing that need the treatment, you know. And so, I mean, you need to, I mean, you need to work on your own self-confidence, I suppose, and say, you know, self-acceptance, and go through the treatment, getting the best care that you can. And I mean, this is a world-class facility, and Professor David is one of the leading experts in his field. So it's a combination of getting the treatment that you need, and you know, having the confidence in yourself to carry on with life during the process and afterwards. Yeah. Which is what you've done.
Well, 10 years ago.
Yeah. Because it's a journey, and if you can go on the journey supported by, you know, by organisations, really, like individuals within organisations, I suppose. And yeah, it helps, it really does. Yeah. I often maybe take the phone call that's their first inquiry, or answer the email that's their first inquiry, and then see them when they get into the consulting rooms. Yeah, so it's good. As right-hand man, I suppose.
Yeah.
Well, we have a very good working relationship. You know, I know what I'm doing, and I think, you know, he appreciates that in the people that he works with, and yeah, we do. It's a very good working relationship. Yeah, based on the trust, I suppose. Yeah.
And
yeah, they trust him because he's able to express to them that he knows what's going on. He has a plan for you know, their treatment, or their child's treatment, and that the plan isn't overwhelming. It's you know, there may be lots of parts to it, but there is a plan, and you will be supported during it, and you will be informed of what's going on. And he's got a very well, not just him, the whole craniofacial team. There's a whole team of people behind him. They're all saying the same thing. They all communicate with each other, and I think that's what builds the trust that the patients have in the team, because there's a plan and there's and you may be told the skeleton of the plan, but you're not overwhelmed with everything to start with, and you don't have to navigate your own way through it. You've got support for people to say, okay, well, this is what's happening now, and this is what's happening here, and it's quite a well organised institution, and based on a lot of trust, I suppose.
That you've ever worked on?
Well, I mean, they're all interesting. I think because
Or memorable?
I think because I know the people behind that form on the operating table.
Yeah.
I have an interest in all of them, but I love seeing. Say if we've got new staff in the operating theatre, the new graduate nurses coming through, or the student nurses, or even some of the trainee specialists that haven't seen it before, and seeing their reaction to the actual steps of the operation, and the final, the end result. Like once everyone's finished on the operating table, because we get to see kind of like the result before the patients and everything. Because by the time they get to recovery and then out to the ward, a lot of swelling has happened, and so they don't get to see the end result till 6 weeks down the track or so, and even longer. But we get to see it before all the swelling's happened, and you think, oh, that looks good, and you see all these other staff that haven't seen it before, and they've been looking worried during the procedure, thinking, oh my goodness, what's this? But at the end, they have this confidence of, oh wow, that's a great result, because it's not like taking someone's appendix out, because that's kind of unseen. It's right there on their faces, and it's really good. I always think that our waiting room is a very interesting place, because that's you're everyone kind of. You're in there together, and it's you can kind of, it's quite a mixture of people's conditions, I suppose, and it's all there on their faces. I always think our waiting room can be an interesting place. So and sometimes, unfortunately, people do have to wait around, because Professor David in particular gives people the time they need. Sometimes your consultation might be 2 minutes if you're just coming in for a review, and he says, oh, you're doing well, off you go. Or it could be an hour if that's what a family needs with their new little baby, or an adult with maybe after a car accident or something like that. So yeah, you can never quite tell what's going to happen in the waiting room, whether people are going to be there reading the same old magazine again and again, or in and out quickly. I mean, I'd already been working in the operating theatre for 10 years or so before I started working regularly with Professor David. So I'd been around enough to not be shocked with what goes on in there, but yeah, it's quite fascinating to see the detail of what goes on, and the quite simple processes of rebuilding bone structure or soft tissue, and then looking at the result afterwards, and whether it's the function, because there's the two aspects of it, the function and the appearance. And you've got to get both right, to make sure that people can, you know, open their mouth and breathe through their nose, and or that the you know, the skull is the right shape to house the brain, and you know, all sorts of aspects, and yeah, and how people look as well, because that's very important. You know, everybody wants to look just like everybody else, so-called normal, but there's a huge range of normal, and you know, I've seen little kids with deformities that have got so much personality that it overcomes it, and you know, people with that are very successful with their education and their careers, that maybe don't quite look the way society says you're supposed to look, but they've, you know, have wonderful family support and relationships, and yeah, it's real. I've seen some wonderful character building because of things that people have to go through, and for them to be supported through our organisations are very important.